Hi everyone, welcome to Rock County Public Health Department's COVID-19 question and answer videos. My name is Jessica Turner and I'm the Communications Specialist for the Rock County Public Health Department. We've been getting some questions about contact tracing and what makes someone a contact who gets quarantined. So today we'll be talking about what puts you at risk for getting COVID-19 from an infected person. When someone tests positive for COVID-19, a contact tracer will call them. During this call, the contact tracer will ask them some questions about where they've been and the people that they've been with so they can determine who is potentially at risk of getting the virus. A person is contagious with COVID-19 2 days before they start to have symptoms. So you might be considered a contact if you were near a person who tested positive for COVID-19 anywhere from 2 days before they got sick to the time that they began to isolate from others. The risk that you'll get sick from an infected person depends on several things. If you live with a person who's infected, you are considered a household contact, which is high risk, and you will be quarantined until 14 days after the infected person recovers or your last contact with them. Being quarantined means that you're at risk, and we want to make sure that you stay away from others so the virus doesn't get passed to anyone else. Again, you can be contagious before you feel sick. We ask that you stay home and avoid contact with others during your quarantine. Ask friends or relatives to do your essential shopping so that you can stay home. If you're not a household member, there are several things the contact tracer will consider. First, how close were you? If you were hugging, kissing, or shaking hands with the person, you'll be considered a close contact and will be quarantined. The second thing they consider is the length of time you were near the person who is infected. If you were within 6 feet for 15 minutes or more, or you spent the night in the same house as the person who's infected, you'll be considered a close contact and will be quarantined. If it's unclear whether you were within 6 feet, but you were at the same indoor gathering for longer than 15 minutes, you might be considered a close contact. The third thing they consider is whether you may have touched respiratory secretions. For example, were you coughed or sneezed on? Did you touch a dirty tissue or napkin? Did you share a drinking glass, food, towel, or other personal items? If so, you are considered a contact. Sometimes you might know or find out that you were near a person who tested positive, but you haven't gotten a call from the health department. There are a few reasons why that might happen. Number one, we don't know about you. If you were not mentioned by the person who tested positive when we talked to them in their contact tracing call, we have no way to know that you were exposed. Sometimes people forget or don't know the names and phone numbers of people they were near, especially in a public location or a large gathering. Number two, it was a low-risk situation. If you were in a low-risk situation, such as in the same building or workplace as a person, but not within 6 feet for 15 minutes or more, then you will not be called. If a person who tested positive was wearing protective gear, including an N95 mask, the contact will be considered low risk and a call will not be made. Number three, it was outside of the contagious period. If your contact with that person was not within that person's contagious period, which is 2 days before their symptoms began until the time that they isolate from others, then you will not be contacted. Remember to contact your healthcare provider for a COVID-19 test if you have any symptoms or if you believe that you've been exposed. If you have any questions for us, be sure to submit them to the email address covid19.questions@co.rock.wi.us, and we'll be happy to answer them in an upcoming video. The best way for us to slow the spread of this virus is to remember the 3 W's. Wear a cloth face covering, wash your hands, and watch the distance between you and other people. Stay healthy and stay safe, everyone.